Hello, future doctors. How are you all? Welcome back to the MedSteps ECG series. So, in day one, we learned about ECG basics and lead placement, and in day two, we learned about the P wave and atrial depolarization. So, today we will learn one of the most important intervals in ECG interpretation. So, the PR interval. So, if you understand the PR interval properly, you can easily diagnose the heart block and pre-excitation syndrome and make conduction abnormalities. So, without time waste, let's start our from the basics. Okay. So, what is the PR interval? So, if you're seeing here, mostly before seeing any ECG, we have to understand some things. So the PR interval is the time taken for the electrical impulse to travel from SA node, atria, and AV node, and bundle of His. So in simple words, the PR interval time taken for electricity to travel from the atrium to ventricle. Okay, so this is the things. Now, how to identify the PR interval? So the PR interval normally begins at start of P wave. You can see here in this image, you can see this is P wave. The P wave means it is atrial depolarization. So the PR interval will start from this P wave and it ends at start of QRS complex. So this is the main spot. So we call that is PR interval. So this PR interval beginning of P wave, beginning of QRS. So for a simple example, imagine a train journey. Okay, the train starts at station A, that is we called SA node. So this is station A, so we call that is SA node. Next we can see another one that it passes through a checkpoint, that is AV node. Okay, that means this is checkpoint, right? So AV node, then it reaches to station B, that is ventricle. This is B station, that is ventricle. Okay, so the travel time between station station A and station B is the PR interval. Okay, so this is the things. So next we can see here that is normal PR interval. In normal PR interval, we can see like 0.12 to 0.20 seconds, or you can see 3 to 5 boxes, 3 to 5 small boxes. Remember, this is exam point of view. If less than 3 boxes, that is short PR interval. If more than 5 boxes, it's a long PR interval. So this is very important. Okay, so for easily, if you want to like any mnemonic, PR means always PR full form, like please remember. So normal 3 to 5 small boxes are 0.12 to 0.20 seconds. So why is there delay? If you're seeing here, this is the normal physiology. Why normally this PR interval will become delay means many students asking this question, because why doesn't the impulse immediately reach the ventricle? Because the AV node acts like a traffic signals. The AV node slows down the electrical impulse. So this delay allows atrial to contract first, then after ventricle to fill with blood, then after efficient pumping. Without this delay, heart pumping becomes insufficient. So important concept if you're saying means here, that is AV node delay and atrial finish pumping blood, then after you can see ventricles fill properly, then after we can see like ventricles will contract and we can see good cardiac output. Okay, so what does the PR interval tell us means? The PR interval tell us about atrioventricular nodal conduction. It helps us determine whether electrical impulses are traveling normally from the atrial to ventricles. So we can see here that is prolonged PR interval. What we have to suspect? If any patient have, for example, this is prolonged PR interval. If this prolonged PR interval greater than 0.20 seconds or more than 5 small boxes, it's called first degree AV block. Okay, so here you can see in first degree AV block, so the ECG findings, what you are going to see here in ECG findings, you can see greater than 0.20 seconds and greater than 5 small boxes. You can see here this is first degree of AV block. Okay, so next one you can see here the ECG findings. If you are seeing P wave and long PR interval, the QRS and all impulses still reach the ventricle, the only problem is the conduction is slow. So the causes of this long PR interval means we have three different types of causes. One is physiological. In physiological, we can see athletes or increased vagal tone patients. Next, we can see pathological. In pathological, because of history of ischemic heart disease or myocarditis or degenerative conduction disease or atrioventricular nodal disease can cause long PR interval. Some drugs will cause long PR interval, that is beta blockers and calcium channel blockers and digoxin and amiodarone. These are the drugs can cause long PR interval. In exam point of view, long PR interval means first we have to suspect first degree AV block. So in clinical examples, the ECG shows the PR interval equal to 0.24 seconds. Every P wave followed by QRS, then that is first degree AV block. So next you can see here that is short PR interval. In short PR interval, you can see PR interval less than 0.12 seconds or less than 3 small boxes called short PR interval. Why does it happen? Because the electrical impulse bypasses the AV node, therefore it reaches the ventricles faster than normal. So next we can see here that is most important cause. This is very important pathological condition. When I am doing cardiology department, I saw this WPS syndrome. Okay, so this WPW means Parkinson-White syndrome. So this Parkinson-White syndrome we can see here, that is accessory pathway, impulse bypass atrioventricular node and short PR interval we can see. So the ECG findings in WPW, the short PR interval, it's like wide QRS and delta wave, and we can see high yield. This is the main high yield multiple choice question the doctor can ask in exams. Short PR interval, along with that if you are seeing any delta wave, if you are seeing anything like delta wave like this, then you have to suspect patient have WPW syndrome. Okay, next we can see here that is PR interval and heart blocks. So what are the structures involved? What are the structures involved in while saying PR interval means one is P wave. P wave means atrial depolarization, and PR interval, that is EV, atrioventricular conduction time, and QRS complex, that is ventricular depolarization. So this PR interval and heart blocks, the heart block occurs when electrical conduction is impaired. So always ask yourself, is the PR interval is normal and is it prolonged or is it progressively increasing? These clues help to diagnose atrioventricular blocks. So first degree block means it will cause PR prolonged and every P has QRS. Second degree block we can see some P waves will be like fail to conduct. So in third degree block we can see like complete dissociation and P and QRS unrelated. Next, in clinical importance, we can see the PR interval helps to diagnose atrioventricular blocks and WPW syndrome and drug toxicity, and some other causes we have like myocarditis, ischemic heart disease, and conduction disorders. So we have here one approach, that is systemic ECG approach. So whenever you read an ECG, find the P wave first. Then after measure the PR interval. Then after is it normal? Is every P followed by QRS? So we have to focus the thing. These 4 steps helps to identify conduction abnormalities. Okay. So in exam point of view, the PR interval starts off P and starts off QRS. In normal, PR will be like 0.12 to 0.20 seconds, like 3 to 5 small boxes. Next long PR will be like first degree AV block. Short PR means we have to suspect WPW syndrome. If AV node, if you're seeing, means responsible for PR delay. So just I'm asking some questions based on this lecture. What are things we discussed? If you understand this topic, you can give me reply in comment section. Okay. So first one, what does PR interval represents? And normal PR interval, how many boxes and how many seconds? And normal small boxes and long PR interval, and cause of what pathological condition you can see in long PR interval and small PR interval, and which structure causes PR interval. Okay. So I'm going to ask one simple question that is very high yield question and most commonly asked pathological condition. That is, for example, yeah, I in while discussing I mentioned about my cardiology department experience, right? That time I got one patient, like 25 years old patient, has palpitations and ECG showing like PR interval 0.08 seconds and delta wave present, and diagnosis, what diagnosis we have to tell, that is WPW syndrome, because PR interval is 0.08 seconds. Actually, the normal interval will be like 12 to 0.20 seconds. So at last today we learned everything about the PR interval, including its normal value, physiology and clinical significance, first degree AV block and WPW syndrome. In day 4, we will discuss the QRS complex, the most important ECG component for understanding ventricular depolarization and many life-threatening arrhythmias we can diagnose. So I'm signing off. We will discuss in our next ECG lesson on this MedSteps YouTube channel. So if you have any doubt, you can ask me in comment section. So till that time,